Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Good afternoon and welcome to Independent RX Forum, the official podcast of the National Community Pharmacists Association. I'm your host, John Beckner. We're glad you could join us. With only 1 week left until NCPA's Congressional Fly-In, we thought it would be a good idea to discuss some of the legislative priorities that our members are going to be discussing with members of Congress on their Hill visits on April 15th and 16th. My guest today is David Weissman. David is Director of Congressional Affairs for NCPA. David, it's great to have you on.
Good to be here, John.
So this year, I think we probably have a number of members that have not participated in fly-ins before, and some of them may not have even participated in a legislative day on the state level. Maybe you can help talk a little bit about what they should expect, and also leading into that, a little bit more about the lay of the land when it comes to the fly-in in general. What are the events that are planned, and what can they expect from a Hill visit?
Yeah, so we'll start down here in Alexandria at the hotel that we're hosting everything at. We'll start off with kind of what to expect, how a meeting's going to go. We'll have some speakers, some other programming like that before we all bus up to the Hill and start off our meetings. So kind of what to expect in a Hill visit, and we'll cover this again the morning of. So you don't have to take notes. We'll tell you again before we head out. We'll do a legislative briefing too to go over all the priorities that we talked about today. So basically, what to expect in a Hill meeting. It'll be you and a few other pharmacists from your state or from that same congressional district. It'll sometimes be with a member of Congress, sometimes just the staff. If it's the member, he'll have his legislative staff there as well. And they'll just kind of want to hear your story, your challenges in your business, how you're helping your constituents, their constituents, your patients. They really love to hear that. You say, "Oh, my patients are in your hometown, congressman," or your biggest city in your district, something like that. They really love to hear the personal stories. Better than Katie and I really can communicate is kind of those personal connections with their districts and kind of
you could set the table for them there. Right?
We do some level setting, and we'll kind of hop in when we need to talk about like the general political landscape or legislatively, talk about other priorities that we've got in CPA. But yeah, generally we kind of let the pharmacists speak for themselves and tell their story, and that's the most effective in our experience. Yeah.
And I'm glad you pointed out the fact that they'll be there with other folks. So there's certain, from a confidence standpoint, there's probably safety in numbers.
We try that if it's a meeting that's smaller, that it's only like one or two.
Yeah.
Katie and I will try to make sure that we or somebody else on the GA team is there as an extra. Usually be bigger than that. There was one I was in last year's fly-in. I want to say it was French Hill from Arkansas. We had 20 pharmacists.
Oh, wow.
So it was a big room.
Probably filtered out into the hallway when
Actually,
you got over
they
there.
found a conference room for us. That's another thing. Sometimes staff will say, "Oh, we don't have a lot of room in the office. Let's pop into the hallway." It's not on the front. There's spaces at a premium on the Hill, especially in some of the older office buildings. And it's kind of fly-in season right now. A lot of other groups will be have been doing this the past couple of weeks and the week that we're there. So, yeah.
Well, I've heard a number of people say that there's really no substitute for a face-to-face visit with these folks. Mm-hmm. So I think that's very important and very impactful, and excited that we're going to have a lot of people here on April 15th and 16th.
312, I think, was the last count that I heard. Probably up to past that.
That sounds like it's above last year.
I think we'll hit capacity. Yeah, certainly.
That's great. And appreciate all you and your team have done to kind of lay the groundwork for that. Of course. So, a lot of work, I'm sure. So let's talk a little bit about priorities. I talked to your colleague Katie earlier about a number of priorities, but what can you share with us regarding some of the things that our members are going to be talking with congressional folks about?
Yeah, so one big priority we're going to be talking about is the Pharmacists Fight Back Act.
Right.
That's HR 6609 and 6610. Jake Auchincloss from Massachusetts is the main sponsor of that. And he has, I'll get to why there's two bills in a sec, but one of them has Chairman James Comer of the Oversight Committee as lead Republican, which is a pretty big get for the Auchincloss office to have that as kind of their lead Republican. Chairman Comer's been great on our pharmacy issues, as obviously has Rep. Auchincloss. So basically what those bills do, this is a reintroduction from last Congress. It's Congressman Auchincloss's like kind of big, ambitious vision for pharmacy reimbursement. So basically it would address PBM abuses in federally funded healthcare programs, Medicare Part D, Medicare Advantage, Medicaid managed care, et cetera. It bans patient steering, requires market-based reimbursement based on NADAC, plus the state's Medicaid fee-for-service dispensing fee, requires PBMs to pass through rebates, has enforcement provisions that are pretty robust. It really does a lot. So one of those bills basically is the Federal Employee Health Benefits Program portfolio, and the other bill is the rest. That's why they're broken up into two, because of Auchincloss's committee assignments this Congress.
I'm glad you mentioned patient steering, and maybe you could go into a little bit more detail about that. How, patient steering's been going on for a long time, but may be beneficial to just the very basics of what happens when a PBM steers a patient.
Mm-hmm. So basically, it's the PBMs kind of steering their patients, a good term, to their own owned or affiliated pharmacy and away from any other pharmacy that wants to participate in the network, which we call any willing pharmacy. So whether that's our members or Walgreens or what have you, they're trying to self-deal and self-direct business to their own affiliated or owned entities.
So, and this bill addresses that. Are there other bills that address patient steering, or is this the only one?
There's been some that kind of handle it individual basis. Great thing about this bill, Pharmacists Fight Back, is that it's kind of taking a lot of aspects of the PBM reform fight and packaging them together.
Okay.
Yeah. And we've seen that as well with HR 4317, right? Buddy Carter's PBM Reform Act, a bunch of which was passed in the last approach package, I'm sure Katie talked about.
Right.
This packages a lot of those kind of next level reforms together.
So, David, another big area of concern is access, patient access, and I understand there are a couple of bills related to that.
Yeah. So one of them is on the TRICARE level.
Okay.
For military members and their dependents, their families. So that's the RX Access Act. That's S4106 in the Senate, HR 6400 in the House. That's Jen Kiggins, Maggie Goodlander, Morgan Luttrell, Chrissy Houlihan in the House.
Okay.
And Senators Cotton and Kane in the Senate.
Kane is my senator from Virginia. So,
yeah, and then the House version is also, Jen Kiggins from Virginia.
Right.
Yeah.
Right. Exactly.
So there's a lot of members who are kind of on board with this bill who are either veterans themselves or they've got a lot of bases in their district because they see the importance of this. So basically what this bill would do is try to address pharmacy access for TRICARE beneficiaries by ensuring fair reimbursement for pharmacies in the network. And an important thing that it does is mandate an audit of ESI, which has had the contract for TRICARE pharmacies since 2009, 17 years. And in that, or almost 17 years.
Probably too long.
Too long. In that entire time, this is the worst part, they've never been audited.
That's unbelievable.
Yeah. So it would mandate an audit as well as making sure that beneficiaries can access the pharmacies they choose and the pharmacies in that network are getting adequate reimbursement. So that, as we kind of ramp up into the National Defense Authorization Act, NDAA, which is, where Congress decides what military programs are going to be funded and where kind of the money for the defense budget's going. They're trying to ride that along with the NDAA, which is very exciting. So we've been talking to those offices and trying to get co-sponsors and all that jazz. So that'll be a major ask.
Very good. And another access bill, I think the ECAPS bill, is that?
Yeah, ensuring community access to pharmacist services. This bill's been around for a while. Both the Pharmacists Fight Back I mentioned is, 2 Congresses now. The RX Access, a brand new bill. But this ECAPS has been around for a little bit. So folks who have come to Fly-In before probably remember it. Basically, it would make sure that our pharmacists are able to get reimbursed for kind of basic health services like treating COVID, RSV, flu. So they'll be reimbursed through Medicare for that, which is great both in terms of patient access. Members of Congress I talk to say, I've got especially seniors, rural medical access is kind of spotty. So they're very excited about it for what it could do for rural and senior access. And it helps, give our pharmacists kind of another economic lifeline.
Exactly. So reimbursement for test and treat where treat is allowed in states.
Yes.
Is that correct?
Yeah. So actually one big difference in this Congress versus past ones is it kind of changes how the state supervision works based on state law. So I know that this is the Ways and Means Committee. I know that the folks over there are excited about its prospects this Congress because of that change. So yeah, that'll be another big topic.
Well, I mean, that's a great bill. I mean, our members were so active in that space during COVID, testing and treating, and not sure where we would be without, what they provided. I think the ECAPs aren't a few of the other pharmacy associations supporting that.
Yeah, that's
effort
definitely
as well.
I mean, obviously the other pharmacy groups tend to be on our side in PBM reform too, but
Right.
ECAPS is definitely one of those kind of encompassing all of the pharmacy world bills. Yeah.
Got it. So what's going on in the LTC space? Are there
Yeah.
bills related to
So that's
that?
another bill that's on our kind of fly-in priority checklist that I'm sure we'll talk about when we're on the Hill. HR 5031. That's Beth Van Dyne is the main sponsor over in the House. This is just a House-only bill right now. So basically, that would try to address some of the financial issues that some LTC pharmacies are experiencing with the Medicare drug price negotiation program by instituting a $30 temporary fixed dispensing fee specifically for the LTC pharmacies. I don't remember the exact number, but it's something like 3/4 of the drugs that they're dispensing for LTC are in the negotiation program.
Right.
So the LTCs are really getting disproportionately affected by that float.
Yeah, and that's an area that more and more of our members are getting involved in. So I think that's again very important. So are all these things that you've shared? There'll be information for folks coming to Fly-In in their packet, right?
Yes.
With important points
Yeah.
to make.
So we'll have a prettified version of what I've been using here for notes
Good.
in everybody's packets, a House, a Senate, a bunch of other handouts. Last year, and I think we'll probably repeat this, we'll have something that tells you, dining around the Hill if you find yourself with extra time for lunch or you want to go out in the town afterwards or whatever.
And I don't want to leave this podcast without mentioning the reception
Yes,
on
it's a good time.
on the 15th. Yeah.
Yeah, so that's on the 15th in the Rayburn cafeteria. So right on the Hill, very convenient on the House side. We're making sure we get a good number of members and staff there. So that'll be a good time. Good time to decompress, network with your fellow pharmacists and CPA staff and congressional staff because it's not all work. There's some fun parts too.
Right. And talked to your colleague Katie earlier. I think the lead in this year, as opposed to previous years, is a big thank you for passing PBM reform.
Yes.
The beginning of the year. So it's always nice to lead with a positive.
It is. We ask members of Congress and their staff for a lot of stuff a lot of the time. So it's nice to be able to start with, thank you for getting this done.
Exactly. So obviously we hope that everybody that wants to come to Fly-In will be able to come, but obviously not everybody can. What are some things that folks at home can do, and what's the plan for maybe sharing information with them post Fly-In?
Yeah, good question. If you're involved kind of on the level back home in the district, I would definitely keep up that involvement.
Yeah.
Go to events that you remember maybe having, pharmacy visits are always great. We can help you arrange that as well. Members really like to go in and kind of see how the sausage is made and see what our members are really dealing with on that kind of basic level.
Yeah, and a lot of questions may be, or a typical question might be, I really would like to meet with my congressman. How do I set that up? And NCPA can help with that,
Definitely.
obviously. Well, David, thanks again for being on. I know you're busy leading up to Fly-In, but this is great information, and thanks again.
Sure.